Hi, everyone. I am Dr. Adrienne Martinez-Hollingsworth. I am a graduate of the Mervyn M Dymally School of Nursing. I received my Master's of Science in Nursing as a clinical nurse leader, and I believe I was cohort 4, which would have had me graduating in the 2013-2014 school year. I will never forget the day that I and some of my classmates were out in front of the nursing school having some coffee. And Dr. Carlisle, who is the president of the university, walked by. And I know he had spoken in some of our classes, and I knew that he was very hands on. But he walked by and he said, "Hey, how did that stats class go?" And I was like, I cannot believe that the president of the university remembered me. And I actually think he said, "Hey, Adrienne, how did the stats class go?" And the idea that there's that level of dedication and commitment to understanding students, to knowing what they're going through, to realizing that most of us are working, we're working parents, we're really struggling to keep up with our studies, but being seen like that was the first experience I'd ever had in any of my educational programs where there was acknowledgement from the very top that I was a person. I was here as an individual doing my best to succeed in the program. But that attention to detail, that personal focus, and that memory really made me feel so special and valued that it really cemented my commitment to CDU, honestly, from then on. And I really remember almost immediately after that experience, I applied for a mini mission maker grant. I started getting involved in research on campus because I was like, I matter here. And that's so important to students that are struggling to get through a difficult program because we're there to do really important work, but you got to graduate first. The Mini Mission Maker grant really changed my entire career trajectory. I had never done research before. I'd done some small community projects, but in a way that wasn't very focused on quantifying the actual effect of what we were proposing. So I actually applied for and received several Mini Mission Maker grants during my time at CDU. And the very first one was looking at febrile seizures in infants. And I'm a, East LA Latina first gen high school grad. And it felt to me very much like when I heard about health in our community, it was diabetes, hypertension, obesity, kind of things that I think is the negative impression, a sort of deficits focus on individuals that reflects their access to healthy food, their access to green space, things that are policy and sort of system level. But focusing on a project and having the funding to focus on a project that is so universal. All kids potentially are at risk for febrile seizures. Being able to realize that this is about health, kind of with a capital H, this is about people in general, and not the unique aspects of my community that are reflections of honestly being a marginalized and minoritized group. So being able to do that project with other students, really focus on something that's a universal danger, potentially a danger for infants and young children, allowed us to really make those connections that what we do here is translatable and important, not just to our communities, although it's important we be part of the conversation, but to a much larger field, a much larger scope. And the work that we do is generalizable in a way that is going to really positively affect communities all over the country. So the Mini Mission Maker allowed me to focus a little bit on health equity, but to really consider us as humans and how much there is that really connects us and how we can really leverage that as we pursue health equity to really build bridges and connections with each other instead of just focusing on the things that make us different. That's an interesting question. I would say that what I love about my community is that we are very family focused. We're a very communal culture, traditionally, Latinos. We're resource sharing and we like to talk. And so I think coming into a scientific community is often seen as reserved for folks who are sort of beep, beep, I'm a scientist, and doesn't really create a lot of space for these deep, meaningful relationships with each other. And so, as a Latina, I think I bring the aspects of my culture that help me grow the peers that I want. That I immediately see anybody who's interested in health equity research as like a sister or brother, and we're sort of doing this together moving forward. And so really breaking down those hierarchical barriers that traditionally exist, because we're just a big community trying to help our community. And so I do credit my background and my grandparents, my parents, for that sort of ethos. And I think it's really helped me build out a program of research and a diverse lab that welcomes anybody who's here for the cause. So I'm currently the director of research and evaluation at AltaMed, and we are one of the biggest federally qualified health center systems in the country. And like many, we have made that pivot to value-based care. CMS would like to see everyone in value-based or alternative payment models by 2030. But I think at AltaMed, and myself personally as a scientist and a clinician, I remember what value-based care was originally derived from, which is not value in terms of financial value, although we tend to think that. Yeah. Value-based care is based on what the patients value, what people value, what's important to them. And that's so in alignment with nursing, which is our philosophy that we are removing the barriers to the body healing itself, helping other people realize their best version of their health based on what they value. And so I think a lot of the new financial models, the payment models, can be a little confusing. But at the end of the day, if we're helping people be healthy on their terms, respecting who they are and who they want to be, then we all win. And honestly, you have a more sustainable and less costly health system when you do it right the first time, because you're actually listening to what people want and need. I would say relationships are everything. And the benefit of living in this giant metropolis is that you can find your group. You can find sort of that niche space where you can support them, they can support you. Odds are much better. You're going to find that group here than you are if you were at school someplace that was much smaller and not as diverse. So while you're here in LA, while you're here at CDU, reach out and develop those relationships, not just with potential future partners in academia or in health systems or in tech, although that's possible, but reach out to your local community. Sort of make sure that you are willing to, in a humble way, take on a role that is purely supportive and not transactional, is not trying to leverage that relationship until you have really established why you're there, why you want to be there. In some cases, that is showing up for 2 or 3 years, not asking anything, moving boxes, serving lunches, checking people in at the table. It's demonstrating a lifelong commitment to really elevate the voices and the needs of the people that we're trying to serve. Because at the end of the day, if you're in healthcare, you are a servant. And as a leader, you are a servant leader. And the idea that we can build these deep, sustainable relationships it's good not just for your program of research, but it's good for our society. It's good for our community. And it really allows us to see the things that we can't see unless we ask other people to share.
Our next question is, when it comes to mentorship, has that you spoke very highly of Dr. Carlisle and how that kind of solidified your stay at CDU. Can you share how mentorship has played a role in your professional growth?
I would say remember that mentorship is a team sport.
Mhm.
Right? So you're never going to find everything that you could possibly need to benefit your personal, professional, emotional growth in one single person. Maybe you will. I've never seen that happen. What I think is more important is for us to be really honest with ourselves about places that we would benefit from some growth or some insight or some support, and then intentionally seek out individuals that meet that specific need. They don't need to be your everything, but they do need to help you. And it should be sort of bi-directional. You're also helping them, right? And that's really important when you're looking for mentors is this someone who is willing to admit that I may have something to teach them? I'm not just here to learn from them, because I may be Dr. Martinez now, but I wasn't always, right? But I don't really remember what life was like when I was a girl growing up in Highland Park, right? I'm too far removed from that now. So if I want the real litmus test of what's happening in the community, it benefits me to have mentees who are willing to show up and share their experiences. And it's my responsibility to be humble and open to the fact that my ideas may be outdated or just flat out wrong. right? So I really subscribe to Freire's pedagogy of the oppressed, which is this idea of no more hierarchies in mentorship, right? We are peers, and this is bi-directional learning. And so don't worry about it being that one special person. Have a whole team of people supporting you. Be willing to learn, whether you're a mentor or mentee, and really grow the peers you want. We have the opportunity to completely address and eradicate the inequities that we see in scientific and clinical research. It starts with us, and it starts with these meaningful, respectful relationships that we establish with students. And so I think the philosophy for me is to assume that the person in front of you is worthy of respect and deserves to be there. Don't create any additional gatekeeping or barriers to make it more difficult for them to do what they clearly are committed to doing. And I think that when you are a person of color in the sciences, many of us have been traumatized through the process of training and education. And it's hard not to carry that trauma and resentment over to students because they're a vulnerable population and they can't really talk back. So you have to really own that you are in a position of power, and it's on you to defuse that power so that you're more able to see each other as respectful equals. You're more able to learn, they're able to learn, and hopefully together we craft the best solution, as opposed to I show up and tell you what to do, and you listen to what I tell you to do. That's not satisfying, I think, ultimately to either person.
Right. Yeah.
I think the most important take home is you are going to do amazing, life-changing, world-changing work. But to do that, you have to survive. And we need you to be the healthiest version of yourself that you can be so that you can help others be healthy. CDU does a lot to support well-being and resilience initiatives. There's a lot of work coming out of family medicine, out of Dr. Lisa Barkley's labs. There are countless resources on campus and some that are embedded into programs. I cannot urge you enough to take advantage of the things that are going to help you be the best version of yourself so that you have the bandwidth and space to help others. Because, we can't fill another cup if our cup is empty. And so whatever it is that we can do to prepare ourselves for the long haul, this is a marathon, for work that is really deeply meaningful to us and to others. Again, we have to make sure that we are ready, we are prepared. And that starts with respecting yourself and your needs, elevating your needs, and making sure that you are taken care of. And that you're really prioritizing your own, not just surviving, but thriving in incredibly rigorous academic situations.
Yes.